Welcome to Optimal Anesthesia. Today, we're taking a swift journey through the remarkable history of opioids and anesthesia. Fasten your seatbelts as we explore key milestones and innovations that have transformed the world of pain relief and surgery.
Our story begins in ancient times, where surgical procedures were nothing short of a nightmare. Can you imagine going under the knife without anesthesia? Well, our ancestors did their best to find ways to alleviate the excruciating pain. They turned to concoctions of poppy seed pod juice mixed with brandy, wine, or even juices of plants like mandragora and henbane. However, the results were, to put it mildly, mixed. In some parts of the world, like France, physicians faced legal consequences for using these early pain-relieving methods. Others attempted the use of sleeping sponges soaked with various substances, instructing patients to breathe through them during surgery. But the effectiveness of these sponges was far from reliable.
While these ancient methods were far from perfect, they did pave the way for the use of opioids in anesthesia. Opioids, derived from the poppy plant, had been used for thousands of years to relieve pain and induce sleep. The ancient Egyptians, for example, turned to opium for pain relief, while the 11th century Persian physician Avicenna recognized opium's power to induce stupor. Fast forward to the 19th century, a period of significant advancement in the controlled administration of opioids. In 1803, a pharmacist named Sir Turner isolated morphine from opium. This discovery marked a pivotal moment in the history of pain relief. Morphine was a game changer. However, it wasn't until the 1930s that another milestone was reached. In Germany, a scientist named Ileb synthesized meperidine, also known as pethidine. This opioid was introduced to the United States in 1946, becoming a vital component of anesthesia, especially when combined with nitrous oxide. But the story doesn't stop there. In the 1950s, a Belgian pharmacologist and entrepreneur named Dr. Paul Janssen would make a groundbreaking contribution to the world of anesthesia. Janssen's team synthesized a remarkable opioid known as fentanyl. This was no ordinary opioid, it was extraordinarily potent. Fentanyl quickly gained recognition for its unparalleled analgesic properties. Its potency was so impressive that it revolutionized the field of anesthesia. Anesthesiologists could now administer lower dosages, reducing side effects and improving patient outcomes. Janssen's pharmaceutical company, Janssen Pharmaceutica, played a pivotal role in distributing and popularizing fentanyl worldwide. As we move into the 1960s, we witnessed the revival of high-dose opioid anesthesia. Morphine and fentanyl take center stage once again. Patients with severe cardiac valvular disease required large doses of morphine for tracheal tube tolerance. Fentanyl's ease of administration and faster postoperative recovery made it a popular choice for anesthesia. The 1980s brought a new era with the introduction of ultra-short-acting opioids like remifentanil. These opioids, combined with the development of computerized infusion devices, renewed interest in total intravenous anesthesia, TIVA. Remifentanil, approved in 1996, represented a significant leap forward in opioid anesthesia, offering unparalleled control during surgery. So, how have these opioid innovations impacted anesthesia practice? Well, it wasn't always a smooth transition. In the United States, there was initial resistance to these new methods due to established practices. However, in Europe, especially in total intravenous anesthesia, TIVA, for cardiac and non-cardiac surgeries, these innovations were embraced more readily. Opioid innovations also influenced perioperative pain management. We shifted from intramuscular opioids to more precise intravenous administration, enhancing patient comfort and safety. Patient-controlled analgesia, PCA, became a common method for self-administered pain relief, giving patients more control over their post-surgery comfort. As we conclude this journey through the history of opioids and anesthesia, we're reminded of the incredible progress made over the centuries. From ancient remedies to the groundbreaking work of Dr. Paul Janssen and the introduction of ultra-short-acting opioids, we've come a long way. These developments have transformed anesthesia practice, making surgery safer and less painful for countless patients worldwide. The historical journey of opioids continues to shape modern anesthesia practices, leading to enhanced patient care and safety. Thank you for joining us on Optimal Anesthesia. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review. Stay tuned for more fascinating journeys through the world of medicine.